what does he think about breastfeeding being one of the best ways to protect our babies from COVID?
Sure. I mean, as we heard from the moms, I mean, I think, breastfeeding, we always say as pediatricians is best, right? One of those reasons is the immune benefits. We know the immune benefits for gut infections, for respiratory, for ear infections, for urinary tract infections. And we hope that's the case for COVID, right? What we know is we know that breast milk contains these antibodies if there's been exposure or there was a vaccination. And what our hope is that presence of the antibodies will incur immunity. And those are the studies that are ongoing now. But for those kids, this may be the only protection we can give them until a vaccination is available.
And Dr. Porto, there's some moms out there who are breastfeeding their kids as old as 7, specifically to give them COVID antibodies. What are your thoughts on this practice?
I think the most important thing is it's a safe practice in the sense that if you're using breast milk that's your own or someone, through milk banks and through someone I think that's safe. I think the difference here is under 5, we don't have a clear treatment or prevention mechanism. For 5 and above, we are lucky enough to have a safe, effective vaccine that provides the best benefit. Because current research, we're not sure how much those antibodies are leading to immunity in those infants.
What about when we're talking about these antibodies from the vaccine? Do they work as well if you've actually had COVID?
We know that in breast milk, at least the studies that have been looked at where they look at antibodies from vaccine and from infection, there are different types of antibodies, immunoglobulins A versus G. But we need to see whether those antibodies will actually lead to immunity. But there are presence of antibodies. They're just different types of antibodies that can still incur immunity.
I think a question going through a lot of moms, if a mom gets COVID, can she pass it to their child? And we'd love to hear your opinion on this.
The great news is that current evidence suggests that breast milk is not likely to spread the virus to babies, right? So that means if you have COVID-19 and you want to breastfeed, you can. You should definitely follow precautions, washing your hands or using sanitizer that has at least 60% alcohol, and make sure you're wearing a mask within 6 feet of the child as well as when you're breastfeeding. So if you do have COVID-19, you should use these measures with mask wearing and hand washing very closely for at least 10 days from the onset of symptoms or when you were tested positive if you were asymptomatic and just were screening.
You're saying that not likely that you're going to transmit COVID virus via breast milk. However, if you have COVID, you can pass it in the other ways, air droplets, contact, that kind of thing. So in a scenario like that, you would want to be particularly vigilant, and you told us what we need to do. Listen, thank you, Dr. Porto, and ladies, thank you so much, Giselle and Janelle. Is a baby there?
We got a special guest. We got a special guest.
That is a happy baby.
Adorable.
Thank you.